All right, welcome back to another exciting lecture in our Stroke Made Simple series. If you are enjoying the content of these videos, please hit the like and subscribe button. It allows other people with similar interests to be notified of these videos. Okay, today we're going to talk about neurovascular anatomy. So we want to understand what the anterior and posterior circulations are. We want to know what the four segments of the vertebral artery are. We want to understand posterior circulation anatomy. We want to understand what a cranial nerve 3 palsy is and why that relates to vascular anatomy. We want to understand what is the circle of Willis. We want to know the four segments of the internal carotid artery. We'd like to know the four segments of the middle cerebral artery. And we're going to go through a lot of material here, but you don't have to take notes. This information is all in the book. This is chapter 4 from the book Stroke Made Simple. So basically, when we talk about cerebrovascular anatomy, there's two parts. There's an anterior circulation that supplies the anterior portion of the brain, and a posterior circulation that supplies the posterior circulation of the brain. So we're going to start off with where all these vessels arise from. They all come off the aortic arch, coming off the heart. And the first major vessel coming off the aortic arch is the innominate artery or the brachiocephalic artery. This bifurcates into a right common carotid artery and a right subclavian artery. The right common carotid artery bifurcates typically at the level of C3 or C4 into an internal carotid artery posterior and laterally, and an external carotid artery anteriorly and medially. Now, why is that? Because remember, your external carotid arteries supply your face, right? So if they're going to supply your face, these vessels, anterior and medial. Whereas if you're going to go supply your brain, that vessel is going to go posterior and lateral up into your brain, okay? The first vessel off the subclavian artery is the vertebral artery, the right vertebral artery. The next major vessel coming off the aortic arch is the left common carotid artery, which bifurcates at the level of C3, C4 into a left internal carotid artery, which goes posterior laterally again, and a left external carotid artery, which goes anterior medially. And then finally, the last major vessel coming off the aortic arch is the left subclavian artery. The first ascending vessel off of this is the left vertebral artery, okay? So all the vessels that go to the brain are fed by vessels that originate off the aortic arch. And that's a very important concept we'll come back to later when we're discussing embolic stroke. So we're going to talk about the posterior circulation first. Remember, both vertebral arteries are the first ascending branch off the right and left subclavian artery. Let's look at the left vertebral artery, okay? The left vertebral artery, and all vertebral arteries, as long as they're patent, have four segments. The first segment is from, which we call the V1 segment, is from its origin to the transverse foramen of C6. The second segment is from the transverse foramen of C6 through the transverse foramen of C1. We call that the V2 segment. The third segment is from the transverse foramen of C1 to the dura, okay? So everything below this, segments V1, V2, and V3, these are all extradural, meaning they're outside of the brain. Remember the last lecture we talked about those three dural structures? Remember the most inner one was the pia, the middle was the arachnoid, and the outer one was the dura. This is the dura, okay? So everything past this is inside the brain. Everything proximal to this is extradural, and again, everything distal to this is intradural. The last segment, the V4 segment of the vertebral arteries, from its dural position to its termination, the vertebral artery terminates into the basilar artery. Both vertebral arteries converge together to form the basilar artery, okay? So again, there are four segments of each vertebral artery, the V1, V2, and V3 segments being extradural, and the V4, the very most distal segment, being intradural or contained within the brain. Now, Both of these vertebral arteries form the basilar artery, but before they do, they give off a branch here called the posterior inferior cerebellar artery, okay? That's the first branch they give off, and again, this is before they form the basilar artery. They also give off immediately the anterior spinal artery, but I don't want you to worry about that right now. I just want you to know the posterior inferior cerebellar arteries come off the vertebral before they form the basilar. After they form the basilar, the next major vessel that comes off, or artery that comes off, is the anterior inferior cerebellar artery. Okay, we call this AICA. In fact, this other vessel, the posterior inferior cerebellar artery, we call that pica. Okay. Now, the anterior inferior cerebellar artery, if you look at the angiogram on the right, has a very characteristic curlicue pattern in it. That's because it wraps around the 7th, 8th nerve complex. So if you look for this vessel on angiogram, look for that little curlicue pattern. After this, we have these pontine perforators. These are very important arteries for stroke. We'll discuss them in a later lecture, but notice that most of the time, you can't see these pontine perforators on angiogram. Sometimes you see a little wisp of one, but it's very hard to see these things. The next major vessel coming off the basilar artery is the superior cerebellar artery, which you see right here. And finally, the basilar artery terminates into two posterior cerebral arteries. So this is the diagram on the left. This is the angiogram on the right. Let's look at the angiogram again and review this. Both vertebral arteries form the basilar artery. Before they do, they give off the posterior inferior cerebral artery, which we call pica. After they form the basilar artery, they give off AICA, the anterior inferior cerebral artery, which has a characteristic curlicue pattern because it wraps around the 7th, 8th nerve complex. The next major vessel that we see is the superior cerebellar artery, or SCA. And finally, the basilar artery terminates into two posterior cerebral arteries. Now, notice what you don't see here again. We don't typically see these pontine perforators. You might see one little one here, but it's very hard to see those on angiography. So when we look at these vessels that come off the vertebral arteries and basilar arteries, they're named based on the distribution they supply. So remember, before the basilar artery before the vertebral arteries form the basilar artery, they give off the posterior inferior cerebellar artery, or pica, which supplies the posterior and inferior portions of the cerebellum. After the basilar artery is formed, we get AICA, the anterior inferior cerebral artery. This is the artery with that curlicue pattern, which you don't see in this diagram. This supplies the anterior inferior cerebellar portions. Next, we have these pontine perforators that supply the pons, and that's a separate lecture we'll get into later. And then the next major vessel that comes off the basilar artery is the superior cerebellar artery, which supplies the superior cerebellum. And finally, the basilar artery terminates into two posterior cerebral arteries, okay? So again, these arteries are named by what areas of the cerebellum supply. The posterior inferior cerebellum is supplied by the posterior inferior cerebellar artery. The anterior inferior cerebellum is supplied by the anterior inferior cerebellar artery. And the superior cerebellum is supplied by the superior cerebellar artery. Again, these pontine perforators we'll talk about in a different lecture. These supply the pons and emanate directly off the basilar artery. Now, one thing about this anatomy is you have to remember these vessels are not straight. God does not make straight lines. You can see like this bow or arc in this basilar artery. So when we're working these arteries, remember, we're straightening them out when we put devices in them. So it's very important to understand these vessels are not straight. Imagine you straighten out this basilar artery. What's going to happen to these pontine arteries? They're going to tear and bleed. So it's very important to understand while we're talking about this simplistically, try to think about this stuff three-dimensionally. So we talked about the basilar artery terminating to both posterior cerebral arteries. This vessel here, by the way, is the superior cerebellar artery, okay? Now, the posterior circulation, which we just reviewed, communicates to the anterior circulation. These are both internal carotid arteries. We'll get into that in a moment, via another vessel called the posterior communicating artery, because it communicates the posterior circulation, or connects the posterior circulation to the anterior circulation. Again, this is called the posterior communicating artery. But look what lies right next to this. This is the oculomotor nerve, cranial nerve number 3, And we just did, in our last lecture, reviewed the midbrain, which contains the nucleus of the third cranial nerve, or cranial nerve 3. What's very interesting about this is an aneurysm of the posterior communicating artery, the artery that connects the posterior to anterior circulation, can press on the outer parasympathetic fibers of this nerve and cause a third nerve palsy manifest by certain symptoms. So here's a picture of this. Okay, we'll go to the symptoms in 1 second. Here's the third cranial nerve. Here's the nucleus. Here's the posterior communicating artery. Notice that this lies right next to the oculomotor nerve, or the third cranial nerve. If there's an aneurysm of that structure, it can push on that nerve and cause a third nerve palsy. It causes the eye to turn down and out. It causes the pupil to dilate, and can also cause ptosis, or the eyelid to droop. So again, those symptoms are ptosis, mydriasis, and the outturning or pupillary dilatation, and the eye turning down and out. Now, when we look at this, remember the third cranial nerve lies right next to the posterior communicating artery. So when the artery has an aneurysm that pushes on the outside parasympathetic pupillary fibers, remember pupillary and parasympathetic, you get pupillary dilatation. Now, third nerve palsy can also be caused by involving the middle of the nerve, the inner fibers, not the outside parasympathetic fibers. And this is from vascular disease such as diabetes. In this type of third cranial nerve palsy, the pupil is spared because it does not involve the outer parasympathetic fibers that result in pupillary dilatation in this example of the aneurysm. So again, it's because the fact that that third cranial nerve runs right next to the posterior communicating artery, aneurysms of the posterior communicating artery can pinch on the outer fibers of the third cranial nerve and cause pupillary dilatation, lid lag, and the eye to be down and out. So again, remember, this posterior communicating artery connects the posterior circulation, the circulation was reviewed, to the anterior circulation, and we'll review that in 1 moment. Now, there's another thing we have to talk about, and that is when we connect the posterior circulation to the anterior circulation, like, why does God do that? Well, the reason God does that is if you had an obstruction in the carotid arteries, you could reroute blood supply from the posterior circulation to the anterior circulation. And if you had an obstruction in the basilar artery, you could reroute blood supply from the anterior circulation to the posterior circulation. In fact, if you look at this darkened area here, it almost looks like a ring or a circle. This is called the circle of Willis, and it's made by the following structures. The bottom of the circle is made by the medial aspects of both posterior cerebral arteries. We just went over that. The side here is made by the posterior communicating artery. We just went over that. These sides up here are created by the A1 segments, and we'll review that in a minute, of both anterior communicating arteries, both anterior cerebral arteries, and they connect together with another communicating artery. This one's called the anterior communicating artery. Now, this is the anterior communicating artery because it's connecting anterior cerebral arteries. This is the posterior communicating artery because it connects the posterior circulation to the anterior circulation. This is an MRA showing that circle of Willis. And again, here we have the back or the bottom of the circle, which is the posterior cerebral arteries, the sides, the posterior communicating arteries, the sides on top, the A1 segment, and you don't see the anterior communicating artery. But what is the purpose of the circle of Willis? Again, it allows us to have collateral flow. For example, if this internal carotid artery is occluded, we can get collateral flow from the back of the brain and the opposite side of the brain. So the circle of Willis is an important anatomic structure for a couple of reasons. The first is it allows collateral flow, or allows blood vessels to supply the brain with oxygen and glucose when other vessels are occluded. There's another very important thing to know about the circle of Willis, and that is there's a lot of arterial bifurcations in the region of the circle of Willis. And you know what really likes arterial bifurcations? Are aneurysms. Now, why is that? That's because people typically are not born with aneurysms. They're born with a genetic weakness in the vessel wall. The flow dynamics at bifurcations are the highest in the brain. So if they have weakened vessel walls, if they're going to grow an aneurysm, it's going to occur at a bifurcation where there are higher flow dynamics or greater pressure exerted on that surface area of that blood vessel. So with that, we're going to talk about the anterior circulation. Remember, there's a right and left common carotid artery. They bifurcate posteriorly laterally at the level of C3, C4 into an internal carotid artery and anterior medially into an external carotid artery. So here's the common carotid artery. Here's the carotid bifurcation, typically at the level of C3, C4. Anterior medially, going to the face, is the external carotid artery. It bifurcates posterior laterally into the internal carotid artery, which will go up into the brain. So here's an angiogram showing the common carotid artery. Posteriorly laterally, this is the internal carotid artery. Anterior medially is the external carotid artery. Notice the external carotid artery has multiple branches. Notice the internal carotid artery has no branches. That's another way you could tell them apart. Sometimes you have retained branches from fetal development in the internal carotid artery, but more often than not, the internal carotid artery will not have branches coming off of it. Now that internal carotid artery has 4 segments, okay? The segment we just saw earlier, the segment in the neck after the bifurcation, is called the cervical segment. We can't call that the neck segment because we're medical professionals. So we have to call that the cervical segment. Once the cervical segment starts at the carotid origin of the carotid bifurcation, again at C3, C4, and travels up to the skull base. That skull base is petrous bone. When the carotid artery goes to that petrous bone or skull base, we call that the petrous segment. The next segment from the skull base or that petrous bone to the ophthalmic artery, which supplies the eye, we call that the cavernous segment. And from the ophthalmic artery, including ophthalmic artery, to the carotid bifurcation, where the carotid terminates into a middle cerebral artery and an anterior cerebral artery, we'll talk about that in a minute, we call that the supraclinoid segment. Now there's 2 very important things to understand here. The first is this ophthalmic artery separates intradural from extradural locations, meaning the ophthalmic artery and everything above it is intradural or contained within the brain. Your eyes are part of your brain. Your ophthalmic artery supplies your brain. So your ophthalmic artery and everything above that is intradural or technically inside your brain. Everything below the ophthalmic artery is extradural. So the cavernous segment from the ophthalmic artery to the skull base, the petrous segment, that part of the carotid artery that goes to the skull base, and the cervical segment in the neck, these are all extradural. The other thing to understand about this is, again, everything above the ophthalmic artery to the carotid terminus is called the supraclinoid segment. The supraclinoid segment has 3 vessels coming off it. These are very important. We know one, where we talk about the ophthalmic artery. We actually know the second one. This is the posterior communicating artery. We just talked about that. It's a communicating artery between the posterior and anterior circulation. And the last vessel, important vessel, comes off the supraclinoid segment is the anterior choroidal artery. And we're going to talk about that in another lecture. For now, just remember the supraclinoid segment and everything in above it is intradural. It contains the ophthalmic artery, the posterior communicating artery, and the anterior choroidal artery. Now, sometimes people call this bend, the supraclinoid segment, the cavernous segment together, they refer to that as the carotid siphon or carotid genu. That's oftentimes used, that terminology. But it's very important to understand these 4 segments. It's extremely important to understand that everything above the ophthalmic artery and everything above it is intradural. And we're going to go over the rest of this anatomy in a second. Again, this is all in the book, so I invite you to look at that. So this angiogram, this is a lateral angiogram. And guess what? This looks very complicated, but I'm showing you this for one reason. We're going to go over this in 1 second. Whenever I look at a lateral angiogram, always look for this. This is that bend in the carotid. It kind of looks like Snoopy's nose. And look what's coming off that bend, this little tiny artery. That's the ophthalmic artery. I'm showing this because it looks very complex, but if you want to orient yourself to a lateral angiogram, Just look for this carotid genu. It looks like Snoopy's nose, and coming off that usually is the ophthalmic artery. So let's look at this. This is another lateral angiogram. And here is that bend in the carotid, the genu. Here's the ophthalmic artery. See that? Ignore the stuff down here. This is the ophthalmic artery. So the ophthalmic artery and above is the supraclinic segment. This is all intradural. What comes after the ophthalmic artery? The posterior communicating artery. And after that is the anterior choroidal artery. So just by identifying this bend, this genu, we could identify the ophthalmic artery, the posterior communicating artery, and the anterior choroidal artery. The carotid artery terminates in the carotid terminus, and we form the middle and anterior cerebral arteries, which we will discuss next. So here's the carotid bifurcation at the level of C3, C4. The internal carotid artery, we just talked about the 4 segments that it has. Here's the carotid genu. The internal carotid artery terminates into a middle cerebral artery laterally and into an anterior cerebral artery medially. The termination of the carotid artery is called the carotid terminus. That's where it terminates. So here's that genu in the carotid artery, the internal carotid artery, and here's the ophthalmic. So this is the beginning of the supraclinic segment. Remember, the supraclinic segment extends from the ophthalmic to the carotid terminus. And then what happens? Well, the carotid artery terminates laterally into a middle cerebral artery and medially into an anterior cerebral artery. What's happening here? Well, there's an anterior communicating artery here that supplies the opposite side anterior and middle cerebral artery. So remember, the carotid artery terminates into the bifurcation of the middle cerebral artery laterally and the anterior cerebral artery medially. Now notice what happens here. The first segment of the anterior cerebral artery is called the A1 segment, okay? Coming off that A1 segment are tiny perforating vessels called medial lenticular striate arteries. Remember, this is a medially oriented vessel. That's why these are named medial lenticular striate arteries. Then coming off that A1 segment is the anterior communicating artery, and distal to the anterior communicating artery is the A2 segment. Notice this anterior communicating artery forms the very top of the circle of Willis. It allows both sides of the brain to communicate with each other. So here's the carotid terminus. Medially from the A1, it connects to the opposite anterior cerebral artery via the anterior communicating artery, and distal to the anterior communicating artery is the A2 segment. Looking at this laterally, this A2 segment separates into 2 major branches. You don't have to know all these branches, but note that when the A2 segment separates or bifurcates, it bifurcates into a pericallosal artery, which is right adjacent to the corpus callosum. That's why it's named the pericallosal artery, and into the callosal marginal artery. If you know that anatomy, you're more than fine. Now, we talked about the carotid terminus. It bifurcates medially into an anterior cerebral artery. The first segment is the A1, but it also bifurcates laterally into the middle cerebral artery. The first segment of the middle cerebral artery is called the M1 segment. Because this bifurcates laterally, this is a laterally oriented vessel, these perforating vessels that come off the M1 segment are called the lateral lenticular striate arteries. Remember the ones coming off the A1 segment? Those are called the medial lenticular striate arteries because the anterior cerebral artery is a medially oriented vessel. The middle cerebral artery is a laterally oriented vessel, so these are called lateral lenticular striate arteries. After this M1 segment, we have the middle cerebral artery bifurcation. It bifurcates into a superior segment and an inferior segment. Let's look at the superior segment. As this ascends around the insular cortex, we call these insular or M2 branches. As it descends down around the frontal operculum, we call these M3 or opercular branches. And as this vessel distributes over the cortex, we call this M4 or cortical branches. So the middle cerebral artery has four segments, the M1 segment, which bifurcates into M2, M3, and M4 segments, okay? So here's another picture of this on the opposite side. Here's the carotid terminus. Here's the anterocerebral artery medially, the middle cerebral artery laterally. Coming off this M1 or horizontal segment are these lateral lenticular striate arteries. As this vessel bifurcates into superior inferior division, as these vessels wrap up around the insular cortex, we call this the M2 or insular segment. As it comes down the frontal operculum, we call this the M3 or opercular segment. And as it extends or the cortex, we call this M4 or cortical segments. Here's another image of this. This diagram's slightly wrong. I'll show this why in a second. This red segment's M1, but really M2 in blue should start right at the bifurcation. As it ascends around the insular cortex, these are M2 ascending branches. As it comes down the frontal operculum, these are M3 or opercular branches. And as this vessel extends out into cortex, these are M4 or cortical branches. Here's another picture of this. By the way, here's our internal carotid artery. Here's our carotid genu. Here's the ophthalmic artery. So between the ophthalmic artery and the carotid terminus is the supraclinoid segment. Remember, the internal carotid artery terminates in the carotid terminus. This vessel extending medially, here's the anterocerebral artery. This is the A1 segment and A2 segments. Laterally at the middle cerebral artery, the first horizontal segment is called the M1 segment, okay? After the bifurcation, we have an M2 or insular branches as they ascend up the insular cortex. As they descend down the frontal operculum, these are called M3 or opercular branches. And as they extend over the cortex, these are M4 or cortical branches. This diagram, by the way, is from Pierce Morse's book, and I'll recommend that at the end of the lecture as a really good source for this anatomy. One thing about this picture is, just ignore this vessel right now. This is the anterior temporal branch, but we've not reviewed that yet. We'll review it later. Just know M1, M2, M3, and M4. That's all I want you to know right now. So here's an angiogram. Here's the carotid terminus. Remember, medially, we have the anterocerebral artery. This is the A1 segment, and as it ascends superiorly, this is the A2 segment. Laterally, we form the middle cerebral artery. The first segment is the M1 segment, followed by the M2 or insular branches, followed by, and notice these M2 branches, as they ascend, they're M2 segments. As they descend or down the frontal operculum, they become M3 segments, and as they go out into cortex, these are the M4 segments. Notice, coming off the M1 segment here, these are lateral lenticular striate arteries. They are these tiny little vessels. Coming off the A1 segment, we're going to call these medial lenticular striate arteries. So here's another angiogram. This is the carotid terminus. Here's the M1 segment, M2 segment as we go around the insular cortex, M3 segment as we go around the frontal operculum, and M4 segments as we go into the cortex. Here's the A1 segment and A2 segment. Now I want you to notice something else. Here's the middle cerebral artery, the first segment against the M1 segment. As we ascend up, this is the M2 or insular segment. As we start coming down, this is the M3 or opercular segments. Notice this little fold here or a loop. You guys see that? These loops repeat. Every branch of the middle cerebral artery in this region forms this loop. These loops can all be lined up to form one part of what was called the Civilian triangle. Now, what is this used for? Well, believe it or not, angiography has been done since the early 1900s. So we didn't have CT or MRIs until relatively recently. Like CT didn't come about until the 1960s, and MRI was not come around until around the 1980s. So a lot of times physicians in the past would do angiograms, and a distortion of this anatomy might indicate there's an underlying tumor or lesion within the brain. So they actually used angiography to indirectly see if there is underlying lesions in the brain. Now, the middle cerebral artery has a superior and inferior division, and that's after the M1 segment. It bifurcates into a superior and inferior division. There are multiple branches of the middle cerebral artery named after the areas of the brain they supply. For example, right here in the middle is the central artery. This overlies the central sulcus, which contains the primary motor cortex. So really, these middle cerebral arteries are named after areas of the brain they supply. I don't think you have to know all the names of these. Just know the segments, M1, M2, M3, and M4. So here we go again. Here's the carotid genu. Here's the ophthalmic artery. From the ophthalmic artery to the carotid terminus. This is the supraclinide segment. The carotid artery extends, terminates, and then laterally we have the middle cerebral artery. We have M1, M2, M3, and M4 segments. Medially, we have the anterior cerebral artery, A1 and A2 segments. The anterior cerebral artery communicates via the anterior communicating artery to the opposite side of the brain. So in review, remember there are two different circulations that supply the brain. The first we reviewed is the posterior circulation that supplies the posterior structures in the brain, and we'll get into more detail in subsequent lectures. And the second circulation we described was the anterior circulation, which supplied the anterior portions of the brain. Remember, all of these vessels arise off the aortic arch initially, okay? The vertebral arteries, which we reviewed, remember, they have four segments. There's a V1 segment from its origin to the transverse foramen of C6. There's a V2 segment as they go through the spinal transverse foramen from C6 to C1. There's a V3 segment from the transverse foramen of C1 to the dura. So V1, V2, and V3 segments are all extradural. And then from the dura to the formation of the basilar artery, this last little segment of the vertebral artery is the V4 segment. Remember, both vertebral arteries form the basilar artery. Before they do, they give off the posterior inferior cerebral artery. After they form the basilar artery, the first major vessel they give off is the anterior inferior cerebral artery. This has a characteristic loop in it, which we don't see in this diagram because it wraps around the 7th, 8th nerve complex. We have multiple pontine perforators extending off the basilar artery, which you don't typically see in angiography. The next major vessel is the superior cerebral artery, and the basilar artery terminates into both posterior cerebral arteries. The posterior cerebral arteries communicate to the anterior circulation via the posterior communicating artery. This is the sides of the circle of Willis. So between the posterior cerebral arteries and the posterior communicating arteries, we have the sides and bottom of the circle of Willis. Here are the carotid arteries. The carotid arteries bifurcate medially into an anterior cerebral artery, laterally into a middle cerebral artery. Both anterior cerebral arteries communicate via the anterior communicating artery. Remember, the first segment of the anterior communicating artery is the A1 segment. After the anterior communicating artery, these are A2 segments. Coming off the A1 segment are medial lenticulostriate arteries. Coming off the A1 segment here are medial lenticulostriate arteries. Remember, the anterior cerebral artery is medially oriented. The middle cerebral artery, on the other hand, is laterally oriented. So coming off the M1 segment are lateral lenticulostriate arteries. Remember, the basilar artery terminates in both posterior cerebral arteries. From the posterior cerebral arteries, you have both posterior communicating arteries that communicate the posterior circulation and the anterior circulation. The carotid artery bifurcates medially into the anterior cerebral artery and laterally into the middle cerebral artery. This A1 segment on both sides forms the top sides of the circle of Willis. They're connected anteriorly via the anterior communicating artery. So this is the A1 segment, anterior communicating artery, and distal to the anterior communicating artery is the A2 segment. Remember, the circle of Willis is also an important site for intradural or brain aneurysms. Why? Because there are multiple arterial bifurcations here, and there's a lot of hemodynamic stress on these bifurcations, and that's why aneurysms more frequently occur there. So again, here's the posterior circulation. Both vertebral arteries form the basilar artery. Before they do, they give off the posterior inferior cerebral artery. After they form the basilar artery, they give off the anterior inferior cerebral artery. Then the next major vessel is the superior cerebral artery, and then finally the basilar artery terminates in the posterior cerebral artery. Notice all these pontine perforators that you typically don't see on angiography. The posterior circulation communicates to the anterior circulation via the posterior communicating artery. Here's the angiogram. Here are both vertebral arteries. Before they form the basilar artery, they give off the posterior inferior cerebral artery. After they form the basilar artery, they give off the anterior inferior cerebral artery, followed by the superior cerebral artery, and then they terminate into both posterior cerebral arteries. Notice it's very hard to see these pontine perforators on angiography. Remember that posterior communicating artery lies adjacent to the third cranial nerve. So aneurysms that arise from the posterior communicating artery can compress the outer parasympathetic fibers of the third cranial nerve and cause a third cranial nerve palsy, which involves pupillary dilatation, the eye being down and out, and lid drooping or ptosis of the affected eye. We talked about the anterior circulation also. This consists of the internal carotid artery. Remember, the carotid bifurcation is typically at the level of C3, C4. The internal carotid artery extends posterior laterally, has 4 segments: a cervical, petrous, cavernous, and supraclavian segment, and extends anteromedially as an external carotid artery. We went through the 4 segments of the internal carotid artery: the cervical segment in the neck, the petrous segment that goes through the petrous bone, the cavernous segment, which is from the skull base to the ophthalmic artery, and the supraclavian segment that includes the ophthalmic artery, the posterior communicating artery, and the anterior choroidal artery. Remember, the supraclavian segment, the last segment of the carotid artery, terminates into a middle cerebral artery laterally and an anterior cerebral artery medially. Again, this is the carotid terminus. This is where the supraclavian segment terminates, and it bifurcates into a middle cerebral artery laterally and an anterior cerebral artery medially. The anterior cerebral artery has 2 major segments: an A1 segment. Extending off the A1 segment are medial lenticular striate arteries. These connect to the opposite side via the anterior communicating artery, and distal to that is an A2 segment. The middle cerebral artery is oriented laterally. So here's the carotid terminus. It bifurcates in the middle cerebral artery laterally. The first segment here is the M1 segment. Because this is a laterally oriented vessel, these perforating vessels are called the lateral lenticular striate arteries. When this vessel bifurcates, as it ascends up the insular cortex, alongside of it, these are M2 or insular branches. As it descends down the frontal operculum, these are M3 or opercular branches. And finally, as it extends into the cortex, these are M4 or cortical branches. So here's the carotid terminus. Medially, we have the A1 segment. Coming off this are medial lenticular striate arteries. Past the anterior communicating artery, which you don't see well here, we have an A2 segment. Here's the middle cerebral artery laterally. The first segment is the M1 segment. Extending off this are lateral lenticular striate arteries. Remember, this is a laterally oriented vessel. This bifurcates into a superior and inferior division. As this ascends up the insular cortex, this is an M2 segment. As it descends down the frontal operculum, this is an M3 or opercular segment. And as it extends over the cortex, these are M4 or cortical segments. Now, when you understand this anatomy, you'll recognize it despite whatever modality you're looking at. Look at this. This is an M ray. Here are both vertebral arteries forming the basilar artery. Basilar artery terminates in both posterior cerebral arteries. The posterior cerebral arteries or posterior circulation communicates with the anterior circulation via the posterior communicating arteries. Here's the carotid terminus. Laterally, we have the middle cerebral artery. Medially, we have the anterior cerebral artery. The first segment of the anterior cerebral artery is the A1 segment. Here's the anterior communicating artery connecting them together. And distal to the anterior communicating artery is the A2 segment. Laterally, we have the middle cerebral artery, the M1 segment of the middle cerebral artery, which bifurcates into a superior and inferior division. Remember, the first part of this vessel as it goes up and hugs the insular cortex is the M2 segment. As it comes down the frontal operculum, it's the M3 segment. And as it extends over the cortex, it's the M4 segment. Now, this is all covered in the book, but sometimes people want more information, and I highly, highly recommend the book Practical Neuroangiography by Pierce Morris. If you understand that, you will really understand this anatomy well. Now, one tip about that book is it's kind of expensive. So there's older editions that have nearly the same information in them. So if you want to save a little money, you could buy an older edition. That just about wraps things up for me. If you enjoy the content of these videos, please like and subscribe so other viewers can be informed of these videos. Thank you very, very much for your time.